This plan is a remarkable example for multilateral cooperation, and Germany is optimistic about the results that have been achieved throughout the first implementation phase of the Global Action Plan so far. However, the current pandemic is threatening hard-won improvements towards reaching SDG 3 and could set us back by years. Thus, the Global Action Plan is more important than ever in order to bundle our efforts and face this challenge together. Germany is convinced that the Global Action Plan will play an important role in achieving progress towards the health-related SDGs.
As we tackle the immediate crisis of COVID-19, the Global Action Plan is critical to ensuring that we do not lose track of our journey towards the health-related sustainable development goals. The GAP is helping to fill gaps. That is its goal. It is bringing the coherence, coordination, and collaboration that we need and expect from the multilateral system.
The Global Action Plan is more important than ever. The message today is clear. We must step up action on the targets where we are furthest behind. We must remain focused on this important instrument for working together to ensure healthy lives and well-being for all.
The Global Action Plan for Healthy Lives and Well-being for All is a right step for ensuring health and well-being. More than ever, we need to act together and push for achieving universal health coverage using evidence and data on what works in fragile and vulnerable settings and what are the low-cost but high-impact health interventions. I also urge our development partners, especially the GAP signatories, to understand more than ever our local context, health priorities, value of having a strong, collaborative and cohesive partnership that's led by the government.
Mali is ready to work hand in hand with all of the agencies of the GAP as a partner, but Mali is in a difficult period and it's needed more than ever. We really need help from our partners, a sustained effort on their part. All 12 agencies and all other partners have to be mobilized to finance primary health care at the community level, and this also includes sufficient salaries for medical staff.
I and my team and the Minister of the Public Health need your guidance, technical and financial support to make Afghanistan fully free, to build a responsive and resilient services, and to ensure that quality primary healthcare services are accessible to all Afghans.
The GAP is an important mechanism to strengthen collaboration and coherence in support of country efforts to achieve the health-related SDG targets. We know that effective collaboration requires the right institutional incentives and accountability structures. A monitoring framework with clear targets and milestones will be critical to getting those incentives and accountability in place.
We encourage each of the multilateral partners to continue these efforts, but also to use both the positive lessons and the challenges outlined in the report to continue to strengthen collaborative ways of working, specifically at the country level.
Now, more than ever, in these COVID-19 times, it is critical to make further and faster progress, from the increasing alignment to maximizing the value for money and the use of the health resources. GAP has a huge potential to stimulate innovation in health.